హలో అండి, నమస్కారం. ఈరోజు మనము డ్రగ్ అడ్మినిస్ట్రేషన్ గురించి కొన్ని క్వశ్చన్లు చేద్దాం. ఫస్ట్ క్వశ్చన్, రిమూవింగ్ ఆఫ్ 250 ml to 500 ml from a peripheral vein is called A. Phlebotomy, B. Venipuncture, C. Vasodilatation, D. Plasmapheresis. So the answer is A. Phlebotomy. Phlebotomy means puncturing of vein or surgical opening of a vein. So here 250 ml to 500 ml from a peripheral vein we will take. For example, blood donation. That time we will take 200 ml to 250 ml to 500 ml. That is called phlebotomy. And what is venipuncture? So we will puncture the vein here. Venipuncture means we will puncture the vein to obtain a specimen. For example, 2 ml of blood sample, like that we will collect. Now that is called venipuncture. Next question, the systemic complication of intravenous therapy includes all except A. Fluid overload, B. Air embolism, C. Infection, and D. Infiltration. So here the fluid intravenous therapy, they will give fluid therapy. So fluid therapy, due to fluid therapy, what is the complications except he is asking. So here we can see fluid overload. Due to fluid overload there is a complication of IV therapy, and air embolism also complication of IV therapy, and also infection also complication of systemic complication of IV therapy. But infiltration, due to canalization it will occur. So the answer is infiltration is the answer. Next we will move on to the next question. Initial signs and symptoms due to fluid infiltration include high degree fever, change in flow of rate, C. Swelling, coldness, mild pain around the insertion site, redness around the insertion site. The answer is C. Swelling, coldness, mild pain around the insertion side. So initially, if while putting canalization, while giving fluid administration, there is a swelling means, and coldness and mild pain will be there means, that is initial stage of intravenous therapy. What is the first nursing action to be taken when infiltration extravasation is observed? Signs include erythema, pain, edema, blanching, and streaking on the skin along the vein. This darkened area at the insertion site. A. Here the question is infiltration extravasation observed. As a nurse, what you will do? What is the nursing action? Elevate extremely, stop the infusion, C. Remove the IV line, D. Infusion, antidote. Here, if you observe infiltration or any other symptom, erythema, pain, edema, blanching, anything, we have to stop infusion. Next, we will see next question. Drip that is running satisfactory may be stopped because here question is IV drip is running satisfactory only, but it will stop in between. Why it is stopping? A vein is obstructed by too tight a bandage, blood clotted in the cannula, the head of the pressure is too low, none of this. So drip line is okay, it is running satisfactory, but in between the flow is stopped, because if any blood clot is there in the cannula, then there is a stoppage in between running drip. So the answer is blood clotted in the cannula. Next question. Drug used in the procedure of maintaining a CVP. So central venous pressure, we will check, we will put central venous pressure, central vein, jugular vein, most commonly we will use. So here now what happened? To maintain that procedure, we will give some medication. Means to patent of that line, we will give some medication. What is that medication? Heparin A, B dopamine, C atropine, D xylocaine. So A heparin. Heparin is anticoagulant drug we will use to maintain central venous pressure. The IV site can be scrubbed with one of the following antiseptics prior to venipuncture. Before doing venipuncture, before doing vein puncture, some solution we will use. What is that? They are here we have asked. A. Pavodine iodine, 7% you will use. B. Sterilium. C. 70% alcohol by 5% Savlon. So we will use only 70% alcohol. C is our answer. Material required for applying pressure at the site, IV site is. What we will use for IV site? Alcohol swab, betadine swab, C. Sterile swab, D. Adhesive bandage. Here C is sterile swab we have to use. One tablespoon equals to how much? 15 ml. 1 tablespoon equals to 15 ml. Next question. 5 teaspoon equals how many milliliters? 1 teaspoon equals 5 ml. Then 5 teaspoon equals to 25 ml. Okay, our answer is B, 25 ml. Next, we'll discuss. Next question. 1 gram equals to 1 teaspoon. Answer is 1 teaspoon. One liter contain of how many deciliters? 10 deciliters. So A 1 deciliter, B 10 deciliter, C 100 deciliters, D 1000. So 10 deciliters equals to 1 liter. What is the meaning of PRN in medication administration? A. Immediately. B. Alternative days. C. Evening and morning. D. When required. Answer is when required. Symbol used for administration before drug, sleeping at bedtime. Before bed, if you will give medication, what symbol you will use? AC, B, HS, C. OD. D. SOS. Before bed means HS. We'll use symbol is HS is at bedtime. Which of the following medication orders are for every other day? So every other day, what we will give in this amount? QD or QH or QOD or PAD. QOD means in Latin, QOD means quaque altera day. Means quaque altera day. The answer is QOD means every another day. While administering medication to a client, a specific drug is to be administered AD. What does AD refers to? A. Right ear. B. Left ear. C. Right eye. D. Left eye. Means right ear only. AD means oris dextra. Means right ear. AS means oris sinister. Oris dextra. Dextra means left. Oris means ear. So dextra means right. Oris means ear. Right ear. AS means oris sinister. Oris means ear. Sinister means left. Okay, left ear. Next we'll move on to the next question. Route of administration by which drug reaches the joints directly. Here we will give directly to the joints. A. Intra-articular. B. Intravenous. C. Intrathecal. D. Intra-arterial. So the answer is intra-articular. Means within the joints. Articular means within the joints. We will give drug administration. Next question. Intraosseous injection given in A. Vein, B. Bone marrow, C. Spinal cavity, D. Muscles. B. Bone marrow. Bone marrow. So intraosseous route means giving injection into the bone marrow is called intraosseous. Next question is, the ideal angle of insertion of a needle for administering an intradermal injection is called is A. 15 degrees angle, or B. 30 degrees angle, C. 45 degrees angle, D. 60 degrees angle. The answer is, for ID injection always 15 degrees angle. How now? This is our skin. This is our needle. Think this is our needle. So the needle, between the skin and needle, there will be a only 15 degrees. So intradermal injection, which degree? 15 degrees length is there between skin and injection. Next question. The nurse should hold the syringe almost flat against the patient's skin at about 15 degrees angle with the bevel up. The administering is A. Intradermal, B. IM injection, C. Intrathecal injection, D. Subcutaneous injection. So already we have discussed 15 degrees angle means intradermal injection. So these are all the few of questions we have discussed. If it is useful for you, please subscribe, share and like. Thank you so much.